My dear students, as we are talking about medical examinations, there are a few more bits and pieces about medical examination. The applicant is not required to have a physical examination. It is not mandatory always, my dear student. It should be noted that equal employment opportunities authorities sanction the use of medical examination only if a legitimate job requirement. If it is not have a legitimate job requirement to have a physical examination, then you can stop to get your medical examination recommended by your company. So, medical examination is only possible when it is legitimate to have a job requirement to get a medical examination. Otherwise, you can refuse. If medical examination systematically screens out those with disabilities or diseases that are not directly related to the person's ability to perform the job and or do not adversely affect the health or safety of others, they will be probably regarded as discriminatory. So medical examination suggested by your company can be discriminatory if it is not relevant to your job, if it is not lead to the adverse effects to the health or the safety of others, if it is not specific related to the works which need to be done by you in the company, and then still your company is asking you to conduct a medical examination, then obviously it would be regarded as discriminatory and you can refuse to take a medical examination suggested by your company. So it doesn't mean that medical examination is a mandatory. It is only mandatory when it is relevant to your job requirement. And if it is not relevant to your job requirement, then there is no need for the medical examination at all. Other controversial issues are also in the medical examination, and we already have discussed it in a brief in the previous slides. And those issues involve about the AIDS screening, drug screening, and the genetic screening. So such kind of screenings also can be avoided if such screenings are not related to your job. There are core decisions that addiction or drug dependencies is a disability that has thrown into the question the legality of such screening practices. So legality of such screening practices can only be ensured when such screenings are related to your job. And if it is not related to your job requirement, then such kind of screenings can be illegal. Screening for HIV/AIDS, although private employees unions and trade associations recommend that employers should not test for HIV or AIDS, but there are some conditions in which HIV or AIDS testing is mandatory and it is important. For example, if someone is working in an army, then maybe it is a requirement. The army bans the HIV positive recruiters because soldiers are expected to fight and bleed. Obviously, the context of the army is very much specific, and in such context, the HIV/AIDS testing is important, because if someone has an HIV or AIDS testing positive, obviously such kind of employees can get into trouble because of the fighting and the bleeding during the army services. So the army has a similar ban to recruit with diabetes and gout. But army is a very health specific or health conscious organization, and in such kind of organization, these screenings are okay. But if you are working in some organization where these screenings are not relevant to your job requirement, you can avoid such kind of a screening, because it would be discriminatory to have such kind of a medical screening.